This video is going to demonstrate what you need to do to set up for intubation. The first thing that we would really recommend that you do before starting is to print off the intubation checklist from the SORT website. That's the Southampton Oxford Retrieval Team website. The reason that we really recommend this is that there's some really useful information with regards to all the equipment that you're going to need, the drugs that you're going to need to prepare, and also some useful information regarding sizing of tubes. Okay, so once you've printed that out, you need to set up your trolley. Okay, and we're going to go through the equipment that you need. First thing that you're going to need is the correct size face mask. Okay, by this point you may have already selected the correct size face mask, but if not, make sure that you've got one ready. Okay, you're then going to move on to making sure that you've got the correct size Goodell. Hopefully you know that to size a Goodell is going to be from the central incisors to the angle of the jaw, so make sure that you have got the correct one available. You're also going to need a Yanker sucker. Please connect that to your suction tubing and have it to the right side of the patient, as that will assist the person doing the intubation. The next thing on the list is capnography. This is to measure the CO2 once intubated, and that's going to determine the correct placement of the tube. So please do find whichever one is available in your area, but get it ready in advance, as it probably will need to calibrate before you start. You then need to select the correct size laryngoscope. There are usually 3 different options of laryngoscope make, Miller, Cardiff Pro and Mac. The person doing the intubation will be able to tell you which laryngoscope they would like and the correct size. So just ask them to have that ready. You will need to check that the light is working, and you can do that inside the bag as well. The laryngoscope is used to move the tongue out of the way and to provide a light to enable the person doing the intubation to insert the tube into the correct place. You will then need to make sure that you have got a stylet available. A stylet comes in a pack like this. It is a rigid wire that is inserted inside the ET tube, but it's important that the stylet does not come out the end of the tube and that it stays within the tube itself. And once the tube has been inserted correctly into the airway, the stylet must be removed. You will also need to have a bougie available. It comes in a pack like this. The bougie is an intubation aid for slightly more challenging intubations, but really important that you have one available. You then need to have the correct size ET tube. On the intubation checklist, there is also a guide as to what size you're going to require, or you may have worked that out on your wet flag. We recommend that you have the correct size tube, the half size below and a half size above. We tend to use microcuff tubes in paediatrics, so you will need to have checked the cuff. You will need a 2 ml syringe to do this, and you will need to inflate with some air to check that there is no leaks, but make sure you deflate the cuff as well. You will also hopefully have a stethoscope available in your bed space, but if not, make sure that you have one again to check for correct placement of the tube. And you will need some elastoplast and scissors to securely fasten the ET tube once it has been correctly inserted. We will direct you to a video about how to tape an ET tube at the end of this video. Some of the additional equipment you will need is an enteral syringe and NG tube. You will have, probably by this point already have used a bag valve mask, but in addition to this you're going to need an Ayres T-piece, which you will have got out the packet ready for the anaesthetist or person doing the intubation to use. So the Ayres T-piece, when it comes out of the packet, you will need to connect to your flow meter. Unlike the bag valve mask, the Ayres T-piece will only work with a flow of oxygen. So ensure that you turn your oxygen on to around 7 litres of flow, ready for your anaesthetist. You will also notice that on the list is also the McGill's forceps. These aren't used in every intubation, but you may want to get these out as well.